All right, hi. My name is Christian, and I'm going to be a healthcare provider today. I'm here with one of my new patients here. His name is?
Um,
What's your name?
Hypersonic.
Hypersonic. Okay, so I'm here with Mr. Hypersonic, all right?
And
He is, how old are you, Sonic?
5.5.
He's 5.5, okay? He's here for a well check, all right? Just so we're going to see how you're doing, all right? So, Mr. Sonic, we're going to do a couple of things with you, all right? We're just going to check you out. We're going to basically do a respiratory assessment along with a cardiovascular assessment, all right? So, how are you doing today? How are you feeling? What does that mean? Okay, anything wrong going on lately? What's going on? How are you feeling?
I have a little cough.
You have a little cough. Okay, so he's complaining of a little cough, so we'll do a further assessment on that. Just for the record, I did wash my hands already. Okay, we did hygiene care prior to this visit. Okay, so he presents to the clinic for a well check. All right, but he does present well groomed. Okay, posture is adequate. Color is adequate for ethnicity. He's able to make good eye contact, and he's responding verbally for a 5.5 year old child. Okay, so we're gonna start with the thorax and the lungs. All right, we're gonna do a general check for on the skin. All right, there's no nodules. Nothing like that. Everything seems normal, just visually here. All right. We're also going to check the lips. All right. For here, I'm just going to open your mouth a little bit here. Okay. So lips, the whole area looks good, pink and moist as it's supposed to. Okay. We're going to check the nares really quick as well. All right. So hey, buddy, I'm going to go into your nose. All right. Just going to check to see exactly what's going on. Okay. Okay. Good there. No issues there. We're going to check the other one. All right. And if you could just really quick for your throat. Okay, good. All right, so we're doing that check, all right? While we're doing the respiratory function, we're gonna check for symmetry, okay? Making sure that both left and right sides of the lungs or the chest really is expanding evenly, okay? So I'm just gonna ask you to take a couple of deep breaths, okay? Take a deep breath. Okay, nice and slow, okay? Good, one more. Good. So he does appear to be have a symmetrical balance here. Okay, nothing is abnormal there. All right. You would look out for things such as barrel chest or anything like that, which is an expansion of the chest for anybody that might have a diagnosis such as COPD. But in this case, he doesn't. He just seems to be a little cough. So it is allergy season. But let's just dig a little further. Okay. So from the chest symmetry, okay, we're gonna do his respiration rate. For the record, for the purpose of this video, we already did his vital signs. Okay, his vital signs, so his respiratory rate is 22 breaths per minute, which is adequate for his age group. Blood pressure came out to 100/60, and his pulse was 100, which is also normal for his age group. We'd also addressed with the parent that there are no drug allergies, no surgical history, or recent hospitalizations or anything of that nature. Okay. So what we're going to do is now we're going to auscultate. Auscultate means we're going to listen. Okay, that's a synonym for listening. So we're going to use the stethoscope. Okay, and we're going to listen to your breath sounds. Well, we're going to listen to the breath sounds first. Okay, we're going to go, and you want to go simultaneously, or okay, left and right, just so you can do a nice even comparison. We're going to do front and back. Okay, so we'll do that really quick. Okay, just take regular deep breaths. Okay, okay. Nice and slow. You don't have to rush. That's okay. Good. Okay, now we're gonna do the back, okay? When you do the back, you wanna go around the scapula here, okay, just to make sure you get the good lung sounds, okay? So you can start. Good. So you go left and right. Good, okay. So here, everything sounds clear. All right, you will be looking for any other adventitious sounds such as crackles, any wheezing, whether it's inspiratory or expiratory, nothing like that really. So that's a good thing. Okay. So now we're going to palpate. All right, palpate. All right. Sonic palpate. That means we're touching. Okay, that's another synonym. Okay, we're gonna do tracheal. I'm sorry, hypersonic. So we're gonna do check here. Okay, we're gonna check for the tracheal. Okay, everything looks midline. Okay. Nothing is abnormal on that aspect. Okay. We're also going to do a test. Okay. Now, can you say the word 99 for me?
99.
Okay, 99. We're going to check for tactile phragmitis. Okay, on both left and right. Okay. Oh, here goes with the cough. Okay, so intermittent cough here and there. Okay, so we're gonna do. Can you say 99?
99.
Okay, again.
99.
Okay, again.
99.
Okay.
99.
Okay, nothing abnormal there, and we're gonna ask you to stand up straight a little bit and repeat the same thing.
99.
Okay.
99.
Okay.
99.
Okay.
99.
All right, a little ticklish there, buddy. Okay, that's okay. So nothing abnormal there. Okay, as far as the sounds go. All right. So that's as far as tactile parameters. Now we're gonna move on to the cardiovascular. Okay, so we're gonna do a general skin inspection. Okay, we're gonna inspect the face again. We're gonna check all the extremities. Right, we're looking for the extremities for any discoloration, any possible circulation issue. Will be evidenced by cyanosis. Cyanosis is like a bluish discoloration. Nothing looks blue, right? Everything looks good here. Okay. We're checking for edema as well. All right. Lips are here. Nothing. Let me see your lips. Okay. They look pink and moist, and also the conjunctiva right here. Everything looks pink and moist as it should be. Okay. The other thing, while I'm checking the extremities here, we're gonna check the fingernails on both left and right. Okay. And what we're checking for is any clubbing, all right, which will be an evidence of hypoxia. Hypoxia means low oxygen, but your nails look pretty good, so I don't think there's a concern there, okay? If there was an evidence of clubbing or any evidence of possible hypoxia, you will want to do further assessments, okay? While I'm on your nails, we're going to do a capillary refill check, okay? So we're going to press down, all right? I'm going to press down and let go, and the color should return back to normal within about 3 seconds or so, or less. Anything more than that, again, might indicate a circulatory issue. Okay, so we're going to check. Okay, we're going to let go. See, come back to pink. You see that? I'm going to do all of that here. Back to pink. That's about a second, maybe second and a half. So we're going to do that. You see, it goes like this. So capillary refill seems to be okay. We're also going to check for any vein distension, jugular vein distension. Okay, if you could just look up for me, look up here. Okay, okay. So nothing. The neck seems normal. Okay, nothing like that. Okay, okay. So he does again have the intermittent cough. Okay, yeah, there he goes, intermittent cough. Good. All right. So now we're gonna listen. We're gonna auscultate. Auscultate is another word for listen, right? And we're gonna use the stethoscope. All right. And the stethoscope we're gonna use both sides, the diaphragm and the bell. Now the diaphragm is used for high-pitched sounds such as S1 and S2, which is normal. If you were to listen to an S3 or S4, then that's a normal heart sound. And then for the bell, which is the smaller side. So this is the diaphragm, big side. This is the bell. And the bell we'll use to detect low-pitched sounds such as perhaps galloper or something like that, all right? So we're gonna listen, all right? And I'm just gonna listen to a couple of areas here, okay? So looking at the patient, okay, we're gonna start with the aortic valve, okay? The aortic valve is on the second, on his right side, okay? The second intercostal space on the right, okay? So we're gonna listen there. Okay, then we're gonna move on to his left side, which is the second intercostal space on the left side with this, which is the pulmonary valve, okay? Okay, Erb's point, other name for it. Then we're going to move down to tricuspid valve, which is fourth intercostal space. So you kind of count the ribs here, about the fourth one. That's the tricuspid. And then we're going to go down to the mitral valve, which is mid-clavicular, fifth intercostal space, a little bit lower, just a bit, and which is also the point of maximum impulse. Good. Okay, so everything's fine. We did that with the diaphragm, and now we're gonna do it with the bell as well. So we're just gonna do it real quick again. Aortic valve, pulmonary valve, both on the second, first one on the right side, then on the left side. Tricuspid on the fourth, intercostal space. Okay, and the fifth one, which is the mitral valve. Okay, good. Everything sounds good. Okay, so now we're gonna palpate. We're gonna palpate, and we're going to touch, and we're going to feel all of his the pulses. Okay, you can play with that. Okay, just be careful. All right, so we're gonna start with the. All right, just look out for me. Oh, let's put this down here for a second. Look out for me, please. Look straight. Okay, I'm gonna come behind, and I'm going to check for the carotid pulse. Okay, now we don't wanna patient passing out, so we're gonna be light with it. Okay, so we're gonna check here. Okay, no jugular vein distension as our per our prior assessment here. Okay, and then we're gonna go to the other pulses. Okay, there are 6 pulses. Okay, so we're gonna check between the basically right of the arm, the antecubital space. Okay, that's your brachial pulse. Hold on, be careful. Okay, let me just put that here. Okay, I just need you to sit over here, Sonic, please.
I'm hypersonic.
Okay, just right here. Thank you. All right, so we're gonna check. We're checking the radial. Okay, that's good. Then we're going to get by the wrist. Okay, we have the radial, which is closer to the thumb. Okay, so that's the pulse there. We're feeling your heartbeat. Okay, and then you have your ulnar. Ulnar is on the other side, closer to the pinky. All right. Now, maybe a little ticklish, okay, but I'm gonna check a pulse behind your knee gaps, okay, behind your knee, I mean. All right, so I'm not sure if you can see it, but we're gonna check here. This is the popliteal, okay? All right, you good?
Yeah.
Okay, you feel the pulse there, okay? And then you have your dorsal pedis, which is on top of the foot. I think you can see it there, right? So we're gonna check for a pulse here. All right, we're gonna check that. Okay. It's a strong pulse, okay, so it doesn't seem to have any circulatory issues. And then we're going to check the last one is your posterior tibia, which is back here as well. All right, we check for edema, okay, no edema there, no circulatory issues. Capillary refill was checked as well, okay. And okay, thank you. Let me just put it back, please. Thank you. All right, he wants to be a doctor in the future. So overall respiratory function, any difficulty breathing? Breathing okay for the most part? You just seem to have a little cough intermittently, right? Okay, good. So in this case, for a well check, besides all the other assessments, vital signs are good. The only issue is intermittent cough, which could be allergy related, so we're not sure. So we're gonna use an ICD code of R05.9, which is given for unspecified cough. In this particular case, we're going to prescribe an over-the-counter cough suppressant such as Delsum, and non-pharmacological recommendations. We would do perhaps some honey to soothe the throat, increase fluids, and get as much rest as possible. Okay. And I would say follow up in about a week to 2 weeks for monitor for improvement, okay? And if there is no improvement or things worsen before that follow-up visit, then we will ask for a sooner follow-up for a further examination or perhaps a stronger pharmacological intervention, okay? So, Sonic, you've done very good. Hypersonic, I'm sorry, you've done very good, okay? And if there are no questions, we'll see you back in a week or two, and hopefully not, and hope that your cough resolves, okay? Thank you for coming in, okay? I appreciate it. All right, and that concludes our video. Thank you.